Hi, my name is Michael Shapiro, and it was a pleasure to work with a great team to select the education for prevention in this year's American College of Cardiology scientific sessions.
And hi, I'm Virani. I'm the editor for the prevention topic collection for ACC.org, which brings new knowledge, new education, as well as guideline-related education for our cardiology community.
So Salim, we learned the results of some late-breaking clinical trials this year and received some high-value education in the prevention track sessions. Why don't we start with the late-breaking clinical trials?
Yes, I mean, we've had a lot of great late-breaking clinical trials. You want to start with Fourier trial?
Yeah, I think that's what everybody wants to know. Fourier, of course, was the most anticipated of the prevention session clinical trials. As you know, Salim, this is a randomized controlled outcomes trial of 27,500 patients with stable vascular disease, most of who've had coronary artery disease, who are on optimized statin therapy with LDL cholesterols above 70, and then they were randomly allocated to either evolocumab or placebo. And as you know, the results showed a statistically significant relative risk reduction of 15% in the composite primary endpoint and an absolute risk reduction of 1.5%. So intriguing results, and now the question of course is, what are we going to do in clinical care given cost-benefit ratios? So on a related note, we also learned about the dedicated neurocognitive sub-study of Fourier called Ebbinghaus. Can you tell us about that?
Yes, sure. So this was a sub-study within the large Fourier trial where patients who were enrolled in the large Fourier trial, a subsection of those, about 1,200 patients, were followed for about 12 months or so to look for any neurocognitive side effects based on some prior studies. And what we found was really that safety signal that was seen in the prior studies was not seen in this short-term study of neurocognitive evaluation in these patients. Similarly, there was no more neurocognitive side effects reported by the investigators. So the news is good as far as short-term follow-up of these patients is concerned. And by the way, I'd like to let our viewers know that very detailed analyses and videos for these trials are available on ACC.org. So talking about the same class of drugs, we had some very intriguing results from SPAR 1 and 2 as well, Michael. So you want to give a little bit of rundown on that?
Absolutely. So as you alluded to, this is another monoclonal antibody approach to PCSK9 inhibition. The agent is bocusuzumab. And this is actually a portfolio of trials, but I'll concentrate briefly on SPIRE 1 and SPIRE 2, which were the large randomized controlled outcomes trials. In SPIRE 1 and SPIRE 2, they enrolled patients with vascular disease, the difference being the LDL cholesterol criteria above 70 in SPIRE 1, above 100 in SPIRE 2. And what we learned actually is that Pfizer pulled the plug on the development program because of an LDL cholesterol reduction attenuation over time. So they started to see initially the 50% LDL cholesterol reduction with the monoclonal antibody, but that result was attenuated over a course of 52 weeks, so that at the 52-week mark, many patients had LDL cholesterols that were dramatically closer to baseline than they initially achieved at 4 weeks. And so we only have short-term data in SPIRE 1 and SPIRE 2 because this drug will no longer be developed, so overall a negative trial. So staying within the field of PCSK9 inhibition, of course, there are drug development programs looking to antagonize PCSK9 in alternative ways.
Correct. So we had the ORION trial, which looked at RNA, messenger RNA interference for PCSK9 inside the hepatocytes. And what we learned was that up to a 6-month period, we have sustained reduction in LDL cholesterol levels, which is good news because most of these drugs that we currently have to be injected either a bi-weekly or a once per month kind of basis, and now you can extend that period out and hopefully improve adherence in these patients as well. So I guess that completes the section on PCSK9s, but we had another trial related to an HDL modulating therapy, CARROT trial. You want to give our viewers a little bit of rundown on that as well?
Absolutely, Salim. So as you know, there's been a lot of controversy within the field of HDL cholesterol raising. In recent years, we've had large randomized controlled trials with extended release niacin and with some CETP inhibitors, and for the most part, the raising of HDL cholesterol with these agents wasn't associated with benefit, and in one instance was actually associated with harm. Though there's still interest in exploring HDL as a therapeutic with alternative methods. And the CARROT study looked at a novel infusion method, actually looking at infusing an immature HDL-like particle, basically contains a recombinant ApoA1 with 2 native phospholipids. And in this trial, they chose patients post-acute coronary syndrome, 301 subjects, and they were randomized to either CER001, the HDL particle, or placebo. and they received the first infusion 1 day post-ACS and then weekly for 10 weeks, followed by a 2-week observation. And the primary endpoint was actually change in percent atheroma volume as assessed by intravascular ultrasound. And what we learned at this meeting actually was there was no statistically significant change in percent atheroma volume even with the infusion of this HDL-like particle. So again, bad news for HDL. So Salim, I think that pretty much caps off the late-breaking clinical trials in prevention. So Salim, let's turn our attention to some of the highlights of the prevention track session, starting with your clinical focus session on combination therapy.
So we had a clinical focus session on combination therapy focusing on how to rationally use non-statin therapies, specifically ezetimibe as well as PCSK9 inhibitors in our patients based on what we know currently. The other session I found very interesting, which you moderated, was the session on great debates in prevention.
Yeah, this was a really highly entertaining and educationally very valuable session. We had 3 great debates, one on the use of coronary calcium and risk stratification, another on the role of aspirin in primary prevention, and another debating whether lipid panels need to be done fasting or non-fasting. All issues, as you know, are very relevant in today's practice. Also very relevant are some of the new diabetes drugs and some of the trial results that we're seeing with those. So tell me about that session.
Yeah, so we have a very good session plan that's going to be looking at data on TZDs as well as the 2 outcomes trial that were presented, EMPA-REG as well as LEADERS trial, to see how we can use diabetes medications now that actually improve cardiovascular outcomes. And last but not the least, we had a great session on controversies in hypertension management. You want to tell our viewers a little bit about that?
Absolutely. Another great 3 debates, this time in controversies in hypertension. The first is surrounding whether we can rely on office-based blood pressure measurements or we should really be doing ambulatory care-based blood pressure measurements. Another on the role of dietary sodium in treating hypertension. And the last debate was whether we can actually apply the SPRINT results to clinical practice. As you know, that's of great controversy. So thanks, Salim, for spending some time with me to recap the prevention section highlights at ACC 2017.
And to our listeners, thank you for being here with us today, and please tune in the future for all the content that we discussed in terms of videos as well as cases will be available on the acc.org/ACC2000 website. Please come back, visit us, and enjoy all the content. Thank you.